the epiglottis or the epiglottic cartilage we have seen in the last lecture. Now we will see the other cartilage, unpaired cartilage, which is shield-like and protects the larynx or laryngeal cavity from the front side and forming the angle or prominence of the larynx, known as Adam's apple. The cartilage is having two laminae. These two laminae, here we can see, these two laminae are joining each other along the inferior two-thirds of the anterior border, forming an angle. This is the angle. This angle is the 90 degree in males, more prominent and forming the prominence of the larynx, which is more marked in uppermost part, and this part is easily palpable in the neck, and this is known as Adam's apple. The measurement of angle is more in females, where it is 120 degree. So the voice of male, adult male, is louder and low pitched, while the voice of female is high pitched voice. So two laminae are forming the angle of the larynx. So it is shield-like. So thyroid cartilage is having two laminae, the right and the left, and joining each other in its anterior border along the lower two-thirds. Upper two-thirds upper one-third remains free and forming a notch. This notch is known as the Supra thyroid notch. So here we can see the notch. This notch is Supra thyroid notch and can be palpated above the laryngeal prominence. The lamina is having four borders: the superior, the inferior, the anterior border, and the posterior border. The posterior border is prolonged upwards and downwards and comparatively thick. So upward and downwards prolongation of the posterior border, and this is forming the superior cornu or horn and the inferior horn or inferior cornu. So two cornua are formed by the prolongation of the posterior border of the thyroid. The anterior surface. Anterior surface is situated behind the skin superficial fascia of the neck between the great vessels of the right side and the left side. A line running forward and downward. In the anterior surface, a line running forward and downwards from the superior tubercle to the inferior tubercle. The superior tubercle is situated in front of the superior cornea, running forward and downward up to the inferior tubercle. This line is known as the oblique line. This line is the oblique line. Oblique line, and this oblique line gives attachment to three muscles. The thyroid. So thyroid, the sternothyroid, and the lowest one is the, and lateral most is the thyropharyngeus. This is the part of the inferior constrictor muscle of the pharynx. So the thyroid, sternothyroid, and thyropharyngeus, these muscles are attached on the oblique line of the thyroid cartilage. This is the superior border. The superior border is convexo-concave from antero-posteriorly. So anteriorly it is convex and posteriorly it is concave. So convexo-concave. While the lower border is straight in anterior part and concave in posterior part. So the upper border is convexo-concave, while the lower border is straight in anterior part, concave in the posterior part. So the inferior border, straight part, is giving attachment to the fibroelastic ligament, the conus elasticus. So here I will draw the thyroid cartilage. First, it is the hyoid bone. This is the thyroid cartilage. And the cricoid cartilage. So hyoid bone, thyroid cartilage and cricoid cartilage. This part is having a membrane known as thyrohyoid membrane. Thyrohyoid membrane. This part of the membrane is thickened to form the little thyrohyoid ligament. Thyrohyoid ligament, and this is the thyrohyoid membrane. The oblique line. Thyrohyoid muscle, thyrohyoid muscle, sternothyroid muscle, and this is the inferior constrictor muscle. Of the larynx. So oblique line is giving attachment to the thyrohyoid, sternothyroid and thyropharyngeus part of the inferior constrictor muscle of the pharynx. Cricothyroid muscle. It is having oblique part and straight part. This is the straight part and this is the oblique part of the cricothyroid muscle, and this is the conus elasticus. Conus elasticus. And here is the formation of the cricothyroid joint. The cricothyroid joint. Now we will see the posterior surface of the thyroid cartilage. The posterior surface is relatively smooth. It is relatively smooth and giving attachment to some structure. This is the site of attachment of thyroepiglottic ligament unpaired. Thyroepiglottic ligament, this is unpaired ligament. The paired vestibular ligaments and paired vocal ligaments. Paired vestibular ligaments and paired vocal ligaments. What is vestibular ligament and what is the vocal ligament? I will explain in detail in the next lecture. So these are two vestibular ligaments and these are two vocal ligaments. Muscles, the paired vocalis muscle, the thyroarytenoid and thyroepiglotticus. So vestibular ligament, vestibular, vocalis muscle, thyroarytenoideus, thyroepiglotticus. So these are structures which are attached on the posterior surface and near the angle are the vocal ligament, vestibular ligament, vocal ligament and thyroepiglottic ligament. The posterior borders are free. These are the posterior borders and these are free and giving attachment to tendinous, the common tendinous attachment of three muscles. So muscles are palatopharyngeus, salpingopharyngeus and stylopharyngeus. Three muscles are attached by a common tendon. These are palatopharyngeus, salpingopharyngeus and stylopharyngeus. This part of posterior surface, this part which is free of posterior surface is forming the lateral boundary of piriformis fossa. It is forming the lateral boundary of the piriformis fossa, which is situated lateral to the epiglottic folds, which are forming the laryngeal inlet. So the thyroid cartilage made up of the two laminae fuse with each other to form the laryngeal prominence or Adam's apple. Now after a short break I will talk about the cricoid cartilage, which is the cartilage forming a complete ring. Only cartilage to do so.